For Your Health, I'm Tracy Hutchins. Well, just this week, silicone breast implants, which were banned more than a decade ago because of safety concerns, came a step closer to being available in the U.S. So what does that mean for women who want breast implants? Here to give us some insight on that is Dr. Brent Mulliken, a plastic surgeon in the California area. Dr. Mulliken, thanks for joining us.
My pleasure.
Tell us a little bit about this advisory panel. Now, what we understand that they are recommending that silicone implants can be sold, but really under some very strict conditions. Tell us about that.
Right. Well, this would be a large departure from what's going on now. Currently, if a woman wants a silicone gel breast implant, they have to be on a study monitored by a scientific board. So certain doctors are enrolled in that study and are allowed to put in silicone gel breast implants. But the advisory committee, not unanimously, actually the vote was about 9-6, but they've preliminarily advised the FDA, which will then decide in weeks to months, to allow the silicone gel breast implants because they think that the complication rates are very similar to those from the saline implants, the saltwater breast implants that are widely used now.
Now, some critics, though, say there are still too many unanswered questions as far as silicone is. I mean, can you understand that? Are you hearing some of those critics as well?
Well, absolutely. And as a plastic surgeon, we're, of course, the patient's advocate. So we don't want to put anything into the patient that will be bad for them in the long run. But I think we have to be scientists as well. We're doctors, but we're also scientists. So we have to look at the studies that have come out, and there have been quite a few of them. And those studies show that what was initially thought was that terrible diseases were due to the silicone gel breast implants. But these studies showed that, yes, terrible diseases do occur in ladies with silicone gel breast implants, but they also occur in ladies with no implants at all. So we can't necessarily say that the silicone gel breast implants were the cause of these terrible illnesses.
Right. Would you advocate more research being done? Obviously, I think one of the criteria that the advisory panel recommended is that, that long-term studies for these women if and when they do get those silicone implants.
Well, I think it's absolutely necessary to follow patients long-term and to keep an eye on them and to examine them every year to make sure that they haven't had a complication. And I think we can keep the risk very low if patients do that. If they come in every year for their examination with their plastic surgeons and if they're enrolled in a registry, in other words, so that everyone who gets a silicone gel breast implant is monitored and followed for safety. All
right. Dr. Brent Mulliken, thanks so much for joining us. And if you would like more information, you can you can head to the Food and Drug Administration's website at www.fda.org. And again, that decision could come within weeks to months. I'm Tracy Hutchins for Your Health.